Hi everybody, Dr. Baumholtz. Let's talk for a minute about wound care. And let's go from something you might pick up if you were hiking to something here in the camp environment. I'm broadcasting from Green Family Camp in, I guess you would say north-ish Central Texas, give or take. And then all the way up to and including surgical wounds. And I'll try to move it along so it doesn't take so long to listen to the whole video. All right, so you're out hiking. You're, let's say, someplace a little bit on the remote side, and you fall and you cut your leg or you cut your arm or you cut your hand, something like that. All right, first things first, let's assess what we have with us and the priorities of what to do. Most important priority is we want to make sure that we control the bleeding. Let's assume for the moment that that's not the issue. That's a topic for a different day. We might do a video on tourniquet application or that kind of stuff. But let's assume for the moment it's just a, it's a cut, but we got to do something about it. Next thing, we got to clean the wound as best we can. Now, we brought drinking water with us. That's great. If we can drink it, we can rinse a wound with it. If not, we've got to get water from a source. We want to make sure that water's clean before we irrigate a wound with it, even if that means we have to boil the water. So we'll boil the water, cool it off, of course, and then we rinse the wound with it. If we have soap of any kind, that'll work. So we wash the wound. Then we want to dress the wound to protect it from further injury and to control it or isolate it from the surrounding environment. And so that would mean clean gauze if we have it, or a clean piece of cloth, some antibiotic ointment if we have it, and then wrap it with either something from a handkerchief to a clean, of course, bandana, or even Coban or Ace if we have it in our medical kit with us. All right. Let's upgrade. Now we're in a place, camp, which has an infirmary, and we have someone that has a cut or a scrape. What are we going to do? Try to get the wound as comfortable as possible. We may use an ice pack for a little bit to really chill the wound down to see if we can get it a little more comfortable. Then we're going to use something like an antibacterial soap and really scrub the wound as thoroughly as possible. If the wound needs to be repaired, we'll apply some surgical antiseptics such as betadine, and then repair the wound based on however the wound presents, whether that's stitches or steri-strips or a simple dressing. We'll then use an antibiotic ointment, and then a sterile gauze for padding, and then a wrap, typically Coban or Ace. Over joints or high moving areas, I like Coban just because I think it sticks a little better. And I'll also make a note that the younger the person, the more likely I'm going to use something like Bactroban versus bacitracin, but ultimately use what you have. Finally, let's talk about surgical wounds. Typically, a surgical wound that was made in the operating room with an incision that is then sewn closed is typically sealed 24 to 48 hours after those stitches go in. I say typically, that's not always. You may want to talk to your surgeon about what he or she prefers in terms of wound management. Generally speaking, most dressings can stay in place from 3 to 7 days, sometimes even longer, depending on surgeon preference and what the operation was. Once the dressing is removed, I have never met a wound in my life that did not benefit from simple soap and water. So you're going to get in your shower and you're going to wash the wounds. Now, if it's if there's some difference to that particular wound or some issue, what you may do is take your general shower, and then you may take an antibiotic soap and rewash that one particular area with the antibacterial soap just to make sure the rest of you is off of that incision. Then your doctor may direct you to use a thin coat of antibiotic ointment and new dressing. In my patients, if there's no ongoing drainage and I don't need to protect the area, I typically give up dressings at this point. If there's likely to be drainage or I need to protect the area, I will continue to use some form of gauze and tape for that area. That is a general overview of wound healing, or at least wound protection and wound management, from a somewhat austere environment, hiking, camping, to a little more controlled, like an infirmary or school setting, all the way up to the surgical operating room. If you'd like to know more, and remember, there are some variations based on surgeon and the surgery that you had, please ask. Have a great day.